Hi, everyone. Welcome to Coffee with ClearScript, a podcast series where we break down the big ideas in pharmacy benefit management. Today, we're focusing on how PBMs can support school districts, in particular with cost control, transparency, regulatory compliance, and other aspects. If you're part of a school district team, a broker, or a consultant who works with one, this episode is for you. And today we're talking with Kyle Johnson. Kyle is Vice President of Sales at ClearScript. Kyle has been with ClearScript for nearly 20 years and in employee benefits for 26 years. He's regarded as an expert in pharmacy benefits designed for self-funded plans, including school districts, tribal groups, healthcare organizations, and other commercial entities. He comes with a stop-loss reinsurance background and a TPA background, and he often speaks at PBM and human resource conferences across the nation. So welcome, Kyle.
Thank you very much, Lynn. Great to see you.
Great, thanks. Let's get started.
You bet.
Kyle, it seems like every organization is concerned about rising healthcare costs these days. What are the main cost-related concerns school districts have when it comes to the pharmacy benefit? Is there anything different than other organizations?
So for school districts, as with any other self-funded or to an extent fully insured plans as well, pharmacy costs is a significant driver. And you shared I've been doing or in the employee benefit space for 26 years. At that time, drugs represented of each healthcare dollar spent 5 or 6 cents. And frankly, PBMs, school districts, or other self-funded plans, most of them didn't really understand or even care who their PBM was. They were mainly looking for an organization that could serve their members. It was more based on service. It was more based on how quickly you answered the phone, how quickly you could get a mail order prescription out the door, et cetera. Obviously, 25 or 26 years later, pharmacy costs of the healthcare dollar represents 25 to almost 30 cents of that dollar. Specialty pharmacy, obviously generated by 2.5% of the membership is representing about 56% of that pharmacy part of that healthcare dollar. So it's a top priority. School districts, it's no different for school districts. I would say school districts probably have a little bit different perspective though, because they are, at least from a public sector, they have constituents to respond to, and those constituents are taxpayers. With private schools, it's obviously a little different, but pharmacy costs, just like all aspects of their overall spending of a budget, is extremely important to try to get a grasp of. So really what they're looking for now versus 26 years ago is generally a PBM that can deliver savings. Now, those savings could be a negotiated drug price, i.e. discounts, rebates, and then, obviously formulary tiering and clinical programs that they offer. But every dollar saved helps, those districts offer and continue to offer competitive, affordable health benefits to their employees and those dependents. And so when you work with ClearScript or a PBM like ClearScript, our goal is not just are you saving on drug costs, but we're trying to give employees a more value as it relates to their healthcare plan, as well as any reimbursement counts they have, whether that's an HRA, an HSA, which is a health reimbursement account, or a health savings account, or an FSA flex spending account, or a VIBA, which many school districts have. And so what we're trying to do is help them leverage their dollars that are in their accounts to spend those wisely from a prescription standpoint, and we've got to also, just like 25 or 26 years ago, we have to offer, which we'll get into more later, exceptional customer service and responsiveness to their members. So
yeah,
that was a little long-winded, but yeah, very I, like everybody else at ClearScript, we're very passionate about school districts. It's a big block of business for us, and one that we're strategically aligned to support.
Absolutely. That's a great point. I know school districts are looking for value just beyond the pricing, so it's incredibly important
Correct.
for both plans and their members trying to get the most from their pharmacy benefit. Another
Exactly.
key another key issue we hear a lot about these days is transparency. There's a lot of buzz in the industry about the importance of, true transparency in pricing and data sharing. Why is transparency so important in PBM pricing, especially for schools?
Yeah. Once again, a great question, and you know, not to mention the fact that at least in Minnesota and many other states, we have what's called HITA requirements, which is Health Insurance Transparency Act. So school districts are required to, at least in Minnesota, to go out to bid every couple of years to, seek all basically basically be assured that they're getting the best possible price at the most transparent way. So transparency is everything, right? So not only are they required to do that, but once again, you have more scrutiny now, or scrutiny now more than ever, based on what's happening or what has happened in the PBM landscape. So school districts, like any other self-funded plan, they need to know exactly where their money is going, and that means there has to be a separation of administrative fees from the drug cost. They can't have hidden markups. There can't be surprises, and frankly, I sum it up that it's our job to come in to a prospect, and if we're fortunate to become their PBM, to our client at renewals, show them what we are charging, what they are paying for our services, and what services we're offering for that payment, so that the school district can then decide, that health plan can then decide, are they getting value, and what value are they getting for the administrative fees that they're paying to us. Without transparency, with hidden fees, admin built into the drug cost, retention, redefining rebates and keeping rebates. Without that disclosure, how can a person make the decision of evaluating what they're getting for what they're paying? I mean, they can't. So transparency also obviously helps district stay compliant with all of their state regulations. Um, and so what we do is we assist for those, HITA requirements or just other transparency requirements. With ClearScript, every cost is documented, it's accounted for, and we will supply that to our school district clients as well as their brokers so that they can meet their statutory obligations with assurance and confidence.
That's great, Kyle. I know you kind of spoke to this already, but maybe you could give us a little bit more detail. Can you give us an example of how PBMs help districts meet their regulatory requirements?
Yeah, so there's really two components. One is the actual data itself. And so that is, that's claims reporting. That's claims reporting at an individual claim level detail. Now, that could be claims as well as rebates. It's rebate reporting at the individual claim detail so that the client knows what what things cost, as well as what they're receiving in rebates, so they can look at from a lowest net cost standpoint. So it's access to that data, which is obviously at our fingertips as the PBM, and we supply that to our benefit plans as well as to their brokers so that they can keep track throughout the year versus a big reveal at renewal, right? Some other organizations will withhold some data, or they're not as forthcoming with the data. So we give data, Lynn. But the other thing that I want to point out to you is, just because you have data doesn't mean it's as valuable as it could be. Meaning, unless you're in the PBM space, how do you really know how to translate that data? What does it all mean? And we live in a very complex, very confusing industry of healthcare. And I would argue it's confusing by design. I mean, there are organizations that make a lot of money based on how confusing they've created this. So we have to, as the PBM, being we live and breathe this, we have to help our client translate that information into, into something that they can understand and make informative or informed decisions that best impact, their members, their dependents, as well as just financially their health plan. So we give the data. We also give the data with a consultative eye. Now that goes to the brokers and the consultants as well, so they can put their stamp on it. But we feel we are best positioned to do that because it's our data. We can interpret the best, and our goal is to help our clients understand what's going on with their pharmacy spend.
Yeah, that makes a lot of sense. So what about school districts that have a lot of unions, teacher unions, and other unions? Is there any difference, or what about unions and complex benefit structures? Does it make a difference for school districts?
Yeah. So school districts, obviously, many of them often work within collective bargaining agreements, and their benefit plans, obviously they can be very rich, which then opens up challenges with how do you manage costs of rich benefit plans. But if there's collective bargaining agreements, if there are unions involved, it's oftentimes very difficult to make changes. So you have to find unique ways to save money within the parameters of also offering very rich benefits. But they tend to also be fairly complex benefits. They're not your rank and file, just straight copay. You see a lot of co-insurance min-max plans. You see once again connecting into different funding vehicles, whether those are HRAs or HSAs or VIBAs. FSAs don't really pertain as much to what we're doing, but HRAs, HSA, and VIBAs definitely do. And so they can be very, very complex. So you really, whether it's ClearScript you're working with or someone else, you really want to be careful who you select as a PBM, that they have the ability to offer complex and complicated plans, but then also continue to find innovative strategies to help manage cost, even though they might be living in a world of rich benefits. So we have a very deep experience in managing union benefits. Really, and this is less of a Kyle comment. This is more of an account services and clinical comment, but really our goal is to prioritize long-term partnerships, and really for us to know how to navigate those budget pressures and help districts really truly deliver real value to their members, while also being assured that they can have their eye on the ball as it relates to protecting their constituents' dollars via taxpayers' dollars.
Yeah, absolutely, Kyle. Especially with rising healthcare costs and competing with budget realities, they also need to provide a comprehensive health benefit for their employees, and
Correct.
they're facing some pretty difficult decisions. What are cost saving strategies that they might be exploring in today's world?
Yeah. What's really exciting about our work that we do with school districts is the fact that it requires working with multiple stakeholders. Those could be HR teams. It could be obviously unions if there are union involved, administrators, i.e. superintendents, school boards, and other vendors that are under intense scrutiny and pressure to do more, offer more at less cost. So, and really, if you look at healthcare costs are obviously a significant driver, but it's not the only driver of a school district. But oftentimes, there's a high level of scrutiny on employee benefits. So we're seeing a lot of interest in programs that reduce costs But how do you couple that with a strategy of not cutting care? Because if we reduce the cost on the pharmacy side, but a member ends up going into the emergency room on the medical side, you haven't saved any money. Likely you've driven up the cost significantly by doing that. So, Lynn, the question is, how do you offer programs that help control and manage that cost and that trend without reducing care? So, what we've found successful, programs that aren't necessarily exclusive to ClearScript, but I think we do a really good job, and arguably, better than most. But things like accumulator or maximizer programs, where we're maximizing dollars that are available from manufacturers, as well as alternate funding models, which are, could be foundation dollars, other grants that are available for really high cost and complex patients. But we also are in the international fulfillment arena, where we can help organizations by providing them with options to fill certain medications internationally. We're not importing those drugs, obviously, as ClearScript, but we can help provide members visibility to those resources, and offer a concierge program or model to help position that member so that they get the medication at the lowest possible cost. And lastly, I'll just add, from a formulary and utilization management standpoint, or obviously that's key. We need to make sure that members, most importantly, have access to what would be deemed as the most clinically appropriate and cost-effective drugs. I state that because I'm sure I'll discuss a little bit later sort of fiduciary requirements of health plans, but that just means that school district, has to offer vendors that are driving the most cost-effective and clinically appropriate drugs for the benefit of the member, not necessarily driving medications to the benefit of the PBM, which is anti-fiduciary. So we want to be very careful. And of course, data-driven insights play a huge role at ClearScript. Once again, I've stated this earlier, but I think we do an excellent job of proactive consultation that helps our school district client adjust to changes in that healthcare landscape real time versus just at renewals, which a lot of times, if you're doing this at renewals, you're doing it too late. The horses are out of the barn, and sometimes it's hard to reel things back. So once a group comes on, we put together 3 and 4 and 5 year plans, and we're intimately connected to that plan throughout the year, keeping them aware of what's happening in not only their own plan spend, but also the healthcare landscape, so that they can make informed decisions in the most timely fashion as possible.
Absolutely right. Consultation is super important to achieving savings and
Correct.
making sure the client's objectives are met and making sure they're getting the best value from their PBM.
Exactly.
So, yeah, when it comes to getting value, contracting is also critical. So, do you have any advice for what districts should look for in their PBM contracts?
Yeah. Well, I might stand on my soapbox a little bit here, so I apologize, but the most important thing, first and foremost, in a relationship is truly the contract. I think people have come to realize that. But Lynn, you would be surprised how many prospects we as ClearScript, me personally, other sales folks here, how many prospects don't even have access to their contract? The PBM's built into their health plan. So really, truly, your question is a tough one. What should school districts look for in their PBM contract? Well, if they don't have a PBM contract, they can't look in it. That's a problem. And if you're in a carrier-driven market that's dominated by the BUCAs, a lot of times that PBM arrangement's built in, and you don't see that. So that's very frustrating for me, trying to work with somebody and get them to a better place. I want to be very careful. Obviously, I'm trying to promote ClearScript, but I just want a member. I want a benefit plan to get to the best fit based on what they've told me their pain points are. Right? There's challenges they're dealing with. What sort of value? Maybe that's ClearScript, maybe that's someone else, but they need to. They're saying they want help. I'm trying to provide it to them. The first thing I say is get your contract. If you don't have your contract, maybe run away from that organization because they're probably not giving you a contract for a reason, right? But obviously, PBM contracts vary from one to the next in terms of the PBM that controls the contract, but also based on, frankly, the individual contract that the PBM has with client A versus client B. Those can vary. School districts, you have to look, just like any plan, you have to look closely at the definitions. What's a brand drug? What's a generic drug? You have to look at exclusions, what's excluded, and those will normally be geared towards what's excluded in order to meet a guarantee that may or may not be in that contract. Audit rights. Uh, if somebody's saying, no, we're not giving you the right to do that, well, that's probably example two of why people should run. Administrative fees, once again, what are all the administrative fees? What are you doing for those so that you can make a decision to see if you're getting value, and especially rebate terms. So from a rebate standpoint, 26 years ago, rebates they were almost non-existent. You got very, very little rebates because specialty, although it was around, was primarily just for like transplant patients and some other really high cost, complex patients. But specialty has caused this explosion in cost, right? It's also driven up significant rebate value that's going back to the plan. So if your PBM is passing back rebates, but they're receiving other revenue from the manufacturer. If the contract doesn't call that out, the PBM keeps that. And you just need to know there's value there that you're leaving on the table, and that should be put into the equation when you're weighting what you're getting from that PBM for what they're delivering. So contracts are very important, and I think I have a lot, Lynn. I'm not a broker or a consultant. Obviously, I work for ClearScript, but I have a lot of friends that are brokers and consultants that have reviewed their own RFPs that they've conducted, and they've looked at, as they've selected a PBM, the contract comes back from the PBM, and they match it up with their RFP, which is the answers to the initial proposal. How many times do you think there's something slid into the contract that wasn't in the RFP? If you guess every time, you would be correct. So at least in my space, the folks, and that's not the universe, but in my little world, the folks I work with have to be very diligent about reviewing the contracts of especially the big PBMs, because oftentimes they'll find things that weren't included, weren't answered one way in the RFP. They're trying to slip something in the contract after the facts. You have to be very careful. I will say, from a PBM standpoint, ClearScript, where our contracts are very transparent, they're very fair. We're quick to get those contracts done. Cheryl and her team does a great job with our contracts. Pass-through pricing, different rebate, arrangements that really make it very easy for that client to see and prospect to see what they're paying for, and what you're getting back. And we help school districts. Our goal is to help the school district make a confident and informed decision that really lead to long-term savings, because no organization, school district or others, want to do anything for just 1 year, right? You don't want to make a change again next year. So you have to work with a partner that's going to set you up for success long term. I will say too, we take our commitment to serving, not as a fiduciary, but definitely being a fiduciary type steward for our clients' pharmacy benefit management costs and investments seriously. We know every dollar counts, and obviously we want to make sure that those dollars are well spent.
Absolutely. We hear all the time about the importance of being able to, trust your PBM that their benefit dollars are being well spent. But beyond savings and looking for a PBM that protects your benefit dollars, what else matters when districts evaluate PBMs?
Yeah, I think, part of it is finding not just PBMs, but finding vendor partners that all work together with the district for a common goal. Obviously, the health plan administrator or TPAs, everybody has to be on the same page, because we're all trying to, ultimately the right partners are all trying to do the right thing, and that making sure we're helping manage the health of the member or patient first and foremost, and then, at what cost. But I'll also say that the biggest thing people are talking about right now, there's really two things. One, I know that you did and Brad conducted a coffee chat on FTC report, and what had happened, or what they've uncovered as it relates to, specifically in specialty generics, PBMs marking up the cost of those drugs at their own fulfillment pharmacies, and then obviously way less revenue or cost at non PBM owned pharmacies. But at their own PBM pharmacy, they're marking those drugs up by, 1,000, 2,000, sometimes as high as, I think I read one report of 7,700% markup. And obviously that's a problem, and it ties into fiduciary requirements. So back in 1974, they came out with the Employee Retirement Income Security Act of 1974, ERISA, and that the process, or the law was put in place, so that the benefit plans overseeing, and a lot of it was financial investments and others, but also your benefit dollars, that that health plans took a fiduciary responsibility of looking out for the well-being of their members, especially as it relates to financial. So you didn't want to waste their dollars. Now, there were some changes with the Department of Labor the last year or so, and previous, as it relates to like 401ks, um, uh, and investment companies have to state whether or not they are a fiduciary or not. Brokers really aren't fiduciaries, but give that information to the benefit plan, so that they know sort of what their requirements are, as it relates to being a fiduciary, and the partners that they're working with. We're seeing Department of Labor shifting the focus now to the health plan. So it's off of 401k. They've made some changes there, and investments. Now we're looking into what are the fiduciary requirements as it relates to a benefit plan. And so it's going to be extremely important that benefit plans sign up with organizations that adhere to being good stewards of an organization's dollars when they're self-funded, because those are dollars that the organization's putting away, but it's also dollars they're taking out of members' checks, right, via contributions. And so they've got to be good stewards, and they're legally fiduciaries from a contractual and an ethical standpoint, but they have to work with an organization that's also going to be built on the tenets of fiduciary stewardship, transparency, and access to data, so that fiduciary can be confident that what they're offering their member doesn't jeopardize them, as based on the fact that they are recognized as a fiduciary for those members. So I think that's the biggest thing that's going on right now, is fiduciary requirements, and then also the FTC report, and shining the light on the practices that a lot of these PBMs have been operating under for many years, frankly. And I think it's positive, and I think that it's exciting. We've been sort of leading this charge for the past 20 years, and feels like the market's finally starting to catch up to that. Um, but I think it's going in the right direction, and I'm proud to work for a company that's really been doing this painstakingly, in some cases, for 20 years.
Absolutely. And we are planning a webcast, a webinar on the FTC
Yes.
report and doing a deep dive on that coming up. So stay tuned for more information on the FTC reports. So I think that takes up our time. We have a ton of great information. Thank you very much, Kyle, for joining us and providing your insights about the needs of school districts. There's lots of great takeaways, but we'll leave it there for now. So again, thanks for everyone for joining on today's podcast. We hope this helped clarify what school districts should look for in a PBM and how ClearScript is uniquely positioned to meet those needs. And if you'd like to learn more about how we support schools or other organizations, visit our website, clearscript.org, or reach out to our sales team. And until next time, stay informed and take care.